New concerns this morning about the rapid coronavirus test that's being used by the White House after a new study finds that it frequently misses positive cases. And there are new developments also about the rationing of the only FDA-approved drug. CNN's Elizabeth Cohen joins us with more. What do we know, Elizabeth?
Allison, good morning. What we know is that 2 weeks ago, the federal government said remdesivir works. This antiviral drug works. And by now, all 50 states are supposed to have received shipments of the drug. But the problem is the amounts per state are quite small. This may be the most sought-after drug on our pandemic-ridden planet. Remdesivir, the only drug shown to work against coronavirus and be authorized by the U.S. Food and Drug Administration. And now the state of California, in guidance to hospitals, says they can consider having a lottery to decide which patients will get it. That's because there's not nearly enough remdesivir to go around. Take San Francisco, for example. They have around 70 patients in the hospital with confirmed coronavirus infections. But so far, they've only been allocated enough remdesivir for about 4 patients for the entire city. Dr. Annie Lukemire is an infectious disease specialist at Zuckerberg San Francisco General Hospital.
Having such limited supplies is challenging.
She knows she will have to tell some patients no.
It's not what we all went into medicine to do. We would like to be able to provide remdesivir for everyone in whom we think it would benefit, and we're clearly just not in that place yet, and that part is really heartbreaking.
How did you feel when you saw that just a handful of patients in all of San Francisco would be able to get this medicine?
We understand that some really difficult decisions are going to have to be made.
And not just in San Francisco. In Texas, for example, they have nearly 1,700 coronavirus patients in the hospital, but the state was allocated only enough remdesivir for about 155 patients. The U.S. Department of Health and Human Services hasn't explained how they decided how much remdesivir to send to each state or why some places got it before others. And that spurred this letter Wednesday from 2 members of Congress asking for an explanation.
I'm concerned that we're not getting this drug that's the first ray of hope in treating coronavirus to the right places at the right time.
He's asking for transparency in how the federal government is rationing the limited supply of the only drug known to help patients with COVID-19.
So, Elizabeth, what does the new study say about these rapid response coronavirus tests that the White House is using?
So, Alison, what this study from NYU researchers in New York City found is that the Abbott test missed about half of all positive cases. In other words, half the time it was saying that something was negative when in fact it was positive. Now, there have been other studies that have also shown that this Abbott test is missing positives. Abbott, for their part, says that the methodology was poorly done in the NYU study, and they say other studies do show that the test works well. But certainly I've spoken with infectious disease experts who say the White House should really consider using another test. This one is very fast, but they said you sacrificed accuracy when you go for speed.